Hello and welcome. The following is a presentation offered by Consumers for Affordable Healthcare to help consumers use CoverME.gov's Plan Compare tool. Consumers for Affordable Healthcare is Maine's health insurance consumer assistance program. CAIC's mission is to help all Mainers enroll in, understand, and use their healthcare coverage. The Plan Compare tool at CoverME.gov will allow you to estimate your financial assistance, know which plans will cover your doctors, hospitals, and prescriptions, what portion of your healthcare costs a carrier will pay, and allow you to filter and compare plans. To find the Plan Compare tool at CoverMe.gov, you can click on Compare Plans under the Shop tab or scroll down and click Compare Plans. You will get started by entering your zip code where you live and then click Start Looking for Plans. On this page, you will list members of your household. Include all members of your household, including yourself and your spouse. There are some exceptions to listing a spouse here or on your application. If you are a victim of domestic violence, you have been abandoned by your spouse, or you file as head of household. Add a domestic partner if you claim them as a dependent or have a child together. And add any claimed dependents, including students up to age 24. If anyone in your household already has coverage through an employer, MaineCare, Medicare, etc., be sure to check the box Not Seeking Any Coverage. Then click Next Step. In this next step, you will enter your total projected household income for 2026. It is important to be as accurate as possible. If your estimate changes as the year goes on, you can update your income at any time. Your estimated financial assistance will include assessment for Marketplace and MaineCare for members of your household who appear eligible based on the information you provided. It is important to remember that eligibility assessments will only appear here for members of your household who are seeking coverage. A MaineCare eligibility assessment may be made for dependents under 21 and persons who are pregnant at the time of application if they need coverage and they meet the income guidelines. On this page, you will see estimated premiums, tax credits, and cost-sharing reductions for individuals assessed as Marketplace eligible. Once you have reviewed this page, click Next Steps. Enter all doctors and specialists you or other plan members will see. You will need to expand the search area if they are more than 25 miles from your zip code. Enter the hospital or hospitals you use most, and enter all medications and their dosage that you take regularly. This is an important part of determining if a plan will cover the care you will need. The amount you will spend on health coverage during the coming plan year depends on the plan you choose and the services you use. Ask yourself important questions like, do you anticipate any major medical procedures? Do you have a chronic condition that requires regular medications and/or specialist visits? Is anyone in your household pregnant or planning on getting pregnant in the coming year? Do you have follow-up visits planned in the coming year? Will you be getting physical therapy? Or do you regularly visit a chiropractor or acupuncturist? Click Continue to Plans to move forward. Before you shop, know your metal levels. These are general rules regarding metal levels. Depending on the kind of medical care an applicant typically seeks and how often they need it will play a significant role in the affordability of a plan. For instance, if a specialist is in-network in a silver plan, but out-of-network in a gold plan, it may be that the silver plan, especially if cost-sharing reductions are applied, is the more affordable option. We will go into these details in the coming slides. Individuals under 30 or who are experiencing a financial hardship can enroll in a catastrophic plan. However, tax credits cannot be applied to catastrophic plans. It is also helpful to understand a few common health insurance terms when shopping for a plan. A premium is the monthly plan payment. You pay this whether you use your coverage or not, even if you meet your out-of-pocket maximum. A deductible is the full cost paid for services, both medical and drug, until the deductible is met. Some plans cover services like office visits before the deductible is met. Some plans are tiered. Preferred tiered providers have lower copay, non-preferred tiers are higher. Your out-of-pocket limit is the maximum amount you will pay for medical care in a year, premiums excluded. A copay is the amount you pay each time you have an office visit or other service. Different provider types have different copays. Annual physicals have no copay. Preferred or non-preferred tiers apply. Coinsurance is a portion of medical care you share with the insurance company after you meet your deductible, but before you meet your out-of-pocket limit. Note that some prescriptions cost less than others. Preferred, generic, and specialty drugs will have different costs, including copays or coinsurance after the deductible is met. The plans offered by insurance companies appear as plan tiles in the Plan Compare tool. To the left of these tiles are filters that you can use to help sort plans. You can edit your coverage profile or start over by clicking here. The members of your household will appear here. You can filter for metal levels, plan type, other plan features such as HSA eligible plans, national networks, and more. And you can also filter by insurance company here. Each plan tile displays plan information using the same format. The plan metal level appears at the top in the plan's name. Additional details about the plan will appear here. The estimated premium after tax credits, annual deductible, and out-of-pocket limit for the plan will appear here. The doctors, hospitals, and prescriptions you added will appear below. You can add or remove providers, locations, and medications by clicking on the Edit button next to the appropriate category. Depending on your household size and household income, you may qualify for cost-sharing reductions, or CSRs. CSRs are only available in silver plans. CSRs help bring down some out-of-pocket costs, like deductibles and copays. And they are available at 3 levels, 94, 87, and 73. In this example, Health Options Clear Choice Silver 3800 HMO, without cost-sharing reductions, would have been Health Options Clear Choice Silver 5000 HMO. Insurance companies contract with providers to set a price for services. If carriers get a better price, so will you. Providers with the green checkmark are in-network and will cost the least. Providers with a yellow checkmark are non-preferred network providers and will cost more. Providers with a red exclamation point are out of network and will not be covered by your plan. If you hover over and click on in-network or out of network, additional information boxes explaining what this means will appear. Just like they do with providers, insurance carriers get better prices for some medications. Drugs are offered in different tiers or as preferred. Drugs with the green checkmark are covered. Hover over your drug list for information about how this plan will help pay for your medications. Drugs with a red exclamation point are not covered by a carrier and will cost the most. We recommend double-checking carrier drug lists if a medication is not showing as covered. Sometimes the Plan Compare tool is missing information that might influence your choice. Please note that generic drugs tend to be cheaper than brand names. You can also see additional information about a plan by clicking on Show More at the bottom of the plan tile. This new section will allow you to see copays associated with doctor visits and drug costs. Next to each plan name is a View Plan Details button. This allows applicants to do a deeper dive into what is covered and what is not. Here you will find links to the insurance company's provider directories and drug search tools that may be more accurate than the Plan Compare tool. By clicking the Compare box on up to 3 plans, it is possible to do a side-by-side comparison of plan details like premium, deductibles, and out-of-pocket costs. In either View Plan Details or when comparing plans, it is easy to find a drop-down menu for various categories that provide detailed information about network status, copays, deductibles, and coinsurance. This is also a good place to find more information about other services, such as fertility coverage or rehabilitative and habilitative services like physical therapy and chiropractor visits. Ultimately, the plan you choose should have premiums and copays that best fit your budget, take into account your eligibility for cost-sharing reductions, have a manageable deductible based on your anticipated medical needs for 2026, provide in-network coverage for the doctors and hospitals you use most, cover the prescriptions you take regularly, and cover any other practitioners or services you regularly use, such as physical therapy, routine lab work, imaging, etc. It is important to note that the Plan Compare tool is separate from the CoverME.gov application. When you have made your selection, write down or take a screenshot of the plan you have chosen. You can also print or save plan details from the Plan Details page. Clicking on Select Plan will bring you to links for CoverMe.gov and MaineCare if anyone in your household qualifies. Look for your plan when you reach the Select Plan section of your CoverMe.gov application. Even if you have Marketplace coverage, you may also qualify for other programs that help pay for out-of-pocket costs like deductibles and prescriptions. Consumers for Affordable Healthcare is a resource for consumers whether they are covered or not. If you need help understanding your plan, updating your application, applying for hospital-free care, or transitioning to other coverage, you can call us Monday through Friday, 8:30 a.m. to 4 o'clock p.m. at 1-800-965-7476. Thank you for watching this presentation on how to use the Plan Compare tool. Consumers for Affordable Healthcare hopes it was helpful, and we look forward to helping you again in the future if you need us.